This week's question was actually from breastfeeding parents from Maui. The question was, Dr. Irene, I need to get an MRI with contrast. Should I pump and dump my milk? So, if you need to have a radiological procedure such as a CAT scan, MRI, or X-ray, sometimes we need to use a contrast agent. In some cases, this is going to be a dye that's injected into your veins. In other cases, you need to swallow it. If you get an injected agent, it's likely going to be either iodine or gadolinium-based dye. Although there haven't been any randomized clinical trials answering this question, studies show that when breastfeeding women receive these agents, less than 1% of the dose goes into the breast milk, and less than 1% of that gets into the baby's bloodstream. That means there's a very small amount, 1% of 1%, that gets into the baby's system, and that has been calculated to be less than the amount that your baby would get if she needed an X-ray with contrast herself. If you are swallowing a contrast agent, it's going to be either a barium dye or gadolinium-based dye. Barium stays in your intestines. It does not pass through to your breast milk, so there's no concern about continuing to breastfeed. Gadolinium dyes that are swallowed also largely stay in the intestine. It's not likely to reach the mother's breast milk. So for these specific cases, you can continue to breastfeed since the benefit outweighs the risk. And you can either give directly from the breast or pump and give your baby with a bottle. As always, send me your general questions if you think it would help another parent.